Thank you, Mr. Chairman, and again, Mr. Sunstein, we're appreciative of you spending so much time with us today. Let me, you wrote a piece for the Wall Street Journal, 21st Century Regulatory Regulation, an update on the President's reforms. You talked a little bit about let's stop crying over spilt milk, but just to set the record straight, you know, everyone in this town loves to blame all of the problems in the world on the previous administration. But sometimes we need to give credit where credit is due to the previous administration. And the spilled milk rule actually was proposed in the Federal Register January 15th of 2009, which was a few days before the President took the oath of office. Is that correct?
Yes, and our final rule is much more aggressive in its deregulation than the Bush proposal.
All right. We'll give the former President credit when we talk about that. I do have to follow up on some of the ACO questions that Ms. Blackburn asked, because this is, you know, the ACOs, in fact, Tevi Troy, and Mr. Chairman, if I may, I'd ask that in today's Politico, Tevi Troy, a former Deputy Secretary of Health and Human Services, now at the Hudson Institute, a senior fellow at the Hudson Institute, said it's time to redraft the rules that cover ACOs. It gives a very good description. ACOs, actually, a concept started with the Physician Group Practice Demonstration Project under Secretary Michael Leavitt in the previous administration. ACOs, well, perhaps not my individual favorite, may have been a bipartisan approach to bringing down the cost of delivering health care in this country, particularly within the Medicare system. Many clinics across the country had embraced this concept, but they were left with a mishmash of a regulation that they just threw up their hands and said, we can't do this. This doesn't work. And yet it was working in their demonstration projects in Secretary Leavitt's administration. Now, one of the things Secretary Leavitt found was that they put a 2% savings before the ACO got to participate in any of the shared savings. There was a 2% barrier. And under the rule, it's now 2% to almost 4%. So what they found under Secretary Leavitt was only 4 out of the 10 practices, as I recall the Physician Group Practice Demonstration Project data, only 4 were actually able to meet that bar, and now we've in fact increased that bar and made it higher. Is that really a positive step in this regulation?
The rule is proposed, and your comments and those of your staff as well as those of your constituents are not just welcome but needed, so we got this right.
But just to be clear, we've got a hard deadline, do we not, in the Patient Protection Affordable Care Act of January 1, 2012. So this rule is going to have to be either revised or reproposed. The clinics are going to have to assimilate this data, digest this data, and decide whether or not they can meet the statutory and the financial requirements, which are significant, all by January 1st, 2012. Is that correct?
If we could, in 4 months, produce 600 pages of look-back plans with hundreds of rules to be revised, then we can get that done on the schedule.
You can get it done, but I'm talking about Geisinger. I'm talking about Mayo Clinic. I'm talking about Gunderson Lutheran. Are these organizations going to be able to do the complex financial analysis that's going to be required in order to meet this January 1, 2012 deadline?
The statutory deadline, yes? Is
yes.
That correct? Yes. Well, we're going to do our best.
You told Ms. Blackburn that no more statutory or legislative interference was necessary, but I would submit to you that perhaps we do need to amend this sacred document to allow clinics more time to analyze what you're going to put forward. Look at what is the minimum financial outlay that a clinic is likely going to have to come up with to institute an accountable care organization by your reckoning?
I don't have a figure for that. This is a proposed rule where all these issues are under discussion.
Well, the figure that's given is like $1.8 million, but the American Hospital Association estimates it's going to be between $11 and $25 million. So it's a significant financial investment. And here's one of the problems with ACOs. I mean, I'm a doctor. Doctors should be in the driver's seat with ACOs. If they're going to really deliver on the promise, as a patient, I want my doctor to be in charge. I don't want my health plan to be in charge. I don't want the government to be in charge. I don't want the insurance company to be in charge. But the doctors are in a poor position to be able to manage the financial outlay, because not only do you have to pay the startup costs of all of the things, the ancillary personnel, the electronic health records, and all the things that are required for disease management, care coordination, but you've also got to manage against the financial risk of taking on a group of patients who have a set of chronic illnesses, which is ideally what the ACO is going to be managing. And here's the problem that we have. We're trying to figure out what to do with the sustainable growth rate formula, and many people were thinking an ACO model may be the way we can pivot to a different way of Medicare payment so we stop paying for stuff and pay for wellness. And you deliver to us a regulation that is so confusing that the people who purport to be able to do this are now shaking their heads and walking away, and we've got 6 months to fix the problem.
Okay, well, I appreciate that. You're clearly a specialist in this, and we need your help to get it right. There was a somewhat analogous controversy over an EOC regulation under the Americans with Disabilities Act. Chamber of Commerce, incidentally, raised many questions about lack of clarity and overreaching. And the first people out of the box to celebrate what the EOC eventually finalized was the Chamber of Commerce. So our hope is we can fix this.
I'm going to submit a question in writing that deals with the FDA and medical devices, because we've heard a lot of testimony about that in this committee. It's an extremely important issue, and the FDA guidance documents that are under development by the agency and how the streamlining process is going to impact those. It's a critical importance, not for our manufacturing in this country, but for America's patients and America's patients in the future. So thank you.
Thank you.
The gentleman, Mr. Bill.